There's a life-threatening outbreak of meningitis here in the UK right now. In this video, I'll cover what you need to know. I'm Zeinab, I'm the pharmacist from PillSorted. I'll cover what meningitis is, what are the symptoms, and what do we need to do to treat this. Since mid-March, we've had an active outbreak, and in the Kent area, there have been confirmed cases of death. There's a couple more cases being investigated, but it is the deadly meningococcal group B, and it has spread in the younger adults, university age, and teenagers. There are two good websites that you can look at for the up-to-date advice and what's going on about it right now. One is the UK Health Security Agency, and the other one is the NHS Meningitis Outbreak. So these two have got the most up-to-date, accurate advice for yourselves. What does meningitis actually mean? Now, around our brain and our spinal cord, there are protective layers that are called the meninge. And what happens is certain type of infections, both bacterial, viral, sometimes parasite, they can attack these protective layers and cause infection. The problem is some of them spread extremely fast and they are life-threatening within hours. So this inflammation of the meninge is called meningitis. That swelling and that infection causes a lot of pressure on the brain and the spinal cord, and it can also cause blood poisoning. So the infection can enter into the bloodstream and cause septicemia. So how does this spread? Around 1 in 10 people have this bacteria and viruses living harmlessly in their nose and throat, and nothing happens to them, but they can be transmitted via close contact, so via coughing, sneezing, kissing, sharing vapes, sharing utensils to other people. And in some cases, these bacteria can become really deadly. Once these bacteria are inside the body, they enter the bloodstream via the nose and the throat, and they their way and cross the blood-brain barrier. And there they spread extremely fast and cause the infection and cause the swelling. And they can damage all of the organs as well. So that's why there will be blood vessels that are getting ruptured. The difference between the viral and bacterial, usually the viral causes of meningitis are not life-threatening, and usually they are treated within 7 to 10 days with rest and fluids, so they don't need that much treatment. However, bacterial meningitis is quite different, and they do cause life-threatening cases. Any bacterial case of meningitis will need hospital treatment, will need an emergency intervention. Now I want to cover the symptoms. The important thing that I want you to remember about the symptoms is a lot of them are quite generic. And what I mean is a lot of different conditions can cause the same symptoms. So for example, usually the first line of symptoms is high fever, vomiting, body pain, and headache. So as you can appreciate how common these symptoms are towards different conditions. So you could easily get dismissed. The next line of symptoms that show up that can be a little bit more distinctive is stiff neck and hating bright lights, confusion, and breathing fast. And there's another group of symptoms as well that might come a little bit later, which could be like too late. So that is seizures, drowsiness that's feeling more like floppy, it's not drowsy, it's floppy, and cold hands and feet, and rashes that we call the non-blanch rashes. Okay, if you see the deterioration happening really fast, so it might show two of these symptoms, but within an hour or two you'll see the teenager, the young adult, the baby is really getting unwell. Don't wait for it. Get more opinions if the first one has been like dismissal. If you feel it's not well, keep on asking for it, okay? In babies, there will be two more things that you can check. One is a very high-pitched cry that babies might make, and the other one is a very swollen frontalis. So the soft part on the top of the baby's head, you'll see it bulging up. Now, what's a glass test? So when I talked about the rashes will show as spots. Sometimes they gather and become a little bit of a blotch. They won't be like a curtain swelling, like allergy sort of thing that comes out. It's more blotches and a lot of spots all around. If you press a clear glass, the rash won't disappear. So that's the differentiator between that and other ones. So for example, if it's a spot out of, I don't know, a insect bite, when you press, it will disappear. But with the meningitis rashes, they won't disappear. If you feel that, or again, if you're worried about any of the other symptoms, call the emergencies, call 999, call 111. They will tell you which ones to go for and which ones will deal with faster. Now, what are the treatments? There's two ways that we treat. The first one is actually prevention. So there's really good vaccinations out there that help prevent. So there is the Meningitis that protects against meningococcal groups A, group C, group Y, and group W, but I'm afraid they don't cover against meningococcal group B. This vaccine, the MenACWY, is offered to year 9 and year 10 teenagers, and it offers a really good protection. So if you have youngsters and they haven't been offered this, please follow up and get this done. For the meningococcal group B, actually, we do it from babies. So babies from week 8 and then 4 to 5 weeks after, week 16. And then a third one when they're 1 year old, or in some cases between 1 year old and 2 year old, they will get the third one. So this will create a good protection against the meningococcal group B from baby ages. Now, for this outbreak, what's happening? The health services are approaching everybody that has been in close proximity, and they're offering a prophylaxis of ciprofloxacin. So that's an antibiotic. It's only a single dose, but it covers a good protection and prophylaxis against the meningococcal outbreak. But generally, if any of these symptoms are worried, if there's an outbreak going on, when you call the emergencies, they will put you on treatment for antibiotics straight away to make sure that they prevent any further harm happening. Does your weight have got anything to do with meningitis and the outbreak? The answer is no. However, sometimes if you're a student and you're using GLP medications, and you might think that these symptoms are GLP side effects, like the headache, like the indigestion problems. But if there's been an outbreak around you, if you feel really unwell, it's better to get it checked and call 111, then wait and assume it's a side effect. So it's better to get checked. As a recap, there is an active outbreak of meningococcal B in the UK. Make sure that you know the symptoms, make sure that you act on it faster, and as always, reach out to us if you need any clinician-led safe advice. Thank you.